sorry about the lighting here. The lighting in this room is not good. This is not my room actually. They moved me here because they are renovating my room. So I had to use the room. The lighting is not good. That's fine. The important thing here is that you can hear me. Now I've already seen one patient. I still have 3 more patients to go. They all have diabetes. And the first patient has got a newly diagnosed type 2 diabetes. I have to talk to him about how to look after himself, how to check his sugar levels at home, what are the normal levels, the diet, the medication, and everything. The other 3 patients, I just need to teach them how to use a sugar meter at home so that they can start checking their sugar meters. And I'm going to be seeing them next time and see how improved their diabetes is. It will be a quick one. Good, how are you? So we talk over the phone and we've agreed for you to start using a new meter,
Yeah.
isn't it? Yeah. Do you have one at home?
But it shows E7 error.
Yeah. The most important level of the day is the morning one, the fasting, before you have anything in your tummy. Check it, that's the most accurate level. Okay? And most of the time we base your management, if we need to change your medication, something that we base it on that level. Because you make sure that your level in the morning is not lower than 4 and not higher than 7. Okay? The rest of the day, it's always not lower than 4, but not higher than 9. Okay? At least we're aiming for something. People with diabetes, you have to have a balanced diet. And a balanced diet doesn't only mean you need to eat nutritious food all the time. Balanced diet means you can have 3 main meals a day, and you can have snacks in between. You need to have some sort of like exercise on a daily basis, whether it's jogging or walking or
I go walk.
what.
I take
Do you exercise? Yeah. Patient number 2 is finished. I'm now about to call patient number 3. Let's go.
Yeah, good. You?
Yeah, have a seat. Guys, patient number 3 done. One more patient tonight, and we're done. Gonna tidy up my notes, and then I'll be ready to call out my last patient for tonight. But first, I'm gonna show you around what's in this room because this is quite new to me. Like what I said, this is not my room. I'm gonna show you around. Okay, let's do it. So we've got this tray or trolley or table, whatever you call it. We've got something for the temperature. Is this? Yeah, that's the temperature. We've got some pathology bags. So for blood tests, we put the blood specimens there. Obviously, we've got gloves. Right. We've got this one is for the stool specimen. Okay. This one is for urine. This one is for ultrasound. Look at that ultrasound gel. You put it in your tummy so that we can do some ultrasound in your tummy. This is a tongue depressor. See? You're familiar with this one? If we need to have a look at deep down your throat or your tonsils, we ask you to stick out your tongue, and we use this one to push your tongue down so that it won't get in the way, so that we can have a good visualization of your tongue. This is just Melbourne pathology. This is just telling us what sort of color of tube we need to use in each test. So trivia, each blood test corresponds the color of the tube. Okay, like for example, if it's yellow tube, that's usually your liver function, your kidney function, your cholesterol, all those stuff. All right, and then we've got alcohol swabs, yeah, to clean your skin if you need to inject something or take some bloods. And then we have this one. This is actually a pregnancy test. If you think that you're pregnant, you can use this one. Go to the toilet and do this one yourself. You already know what to do with this one. You already know how to interpret the result. If it's 2 lines, that means you're pregnant. If it's just 1 line, bad luck. You need to try again. You and your husband, or you and your husband needs to try again, and see how you go. This one are just some of those. Yeah, we got these tubes here for the blood test, and then this one to prick your finger for diabetes blood sugar testing. Okay, and we got some needles here too as well to inject, used to inject and draw out some bloods. What else? Okay, this room is used by physios as well, so they have dumbbells for exercises. Look at that, see? I'm feeling strong now. And then as usual, in each consulting clinic, we have a patient bed. If you want to do some physical examination, they can lay down there and have some assessment. And then weighing scale, if you want to monitor the weight, that's just the spine, okay? Because this room is used primarily by physios, and they need to demonstrate to the patients the different levels or parts of the spine. That's the exercise bike, as you can see. And this is where the patients will usually sit there, or their family, and this is where the patient will sit. And then we have there for the blood pressure. Okay, this is the otoscope used to have a look at the inside of your ear. Okay, obviously we've got a hand sanitizer, we got the phone to call the reception if we need something, or to call patients, and we got 2 mobile phones for telehealth. And then that's the table, that's the screen. Okay, this is for the height. Okay, height, the patient will just stand against the wall, and then we measure their height. And then all of those documents that we need for imaging, if I need to order some x-ray or CT scan, these are the papers that I need to use. Or if I need to order some blood test, this is the paper that I need to use. This is the printer. This is the sink for hand washing. Okay, and that's the paper towel. That's the soap. See, it's telling us how to do a proper hand washing. This is the sharps container. Here in Australia, if it's yellow, that means it's a sharps container. Or if it's a bin, that means a infectious waste. Okay, yellow bin. And this is if the patient is having difficulty of breathing or unwell or unconscious, you follow this. Doctors ABC. That stands for check for dangers, check if the patient is responsive, you send for help, open the airway, normal breathing, and then you start CPR. And then once the machine is arrived, or the clinical team has arrived, then you can start defibrillating the patient. So that's it, guys. This is the new room that I'm using today. But once my room is fully renovated, then I'll go back there. Guys, I'm finished for the day. I've done typing my notes. I've seen 4 of my patients. It was a successful day. Thank you for joining me in another A Day of a Life as an NP, as a diabetes practitioner, as a prescriber, and I'll see you again next time.